He's a fighter. I mean, the guy is a fighter. Let's just put it that way. Yeah, he's a survivor. There's no doubt about it.
That is Representative Andy Biggs talking about his friend and colleague John McCain on news that he has been diagnosed with brain cancer.
Yeah, we learned the news about our senior senator yesterday that a blood clot he had removed last Friday was indeed associated with glioblastoma. That's a brain tumor and an aggressive form of cancer. This morning, a lot of us, of course, are wondering, so what does this all mean? What's ahead for Senator McCain? What's he really dealing with?
So joining us this morning with some insight is Dr. Hiral Tipirneni, and we appreciate you joining us this morning. Everybody's talking about how tough Senator McCain is. We know that mentally and physically.
Absolutely.
How much does that play into recovering from something like this?
Well, I think it plays a great deal. I mean, he's obviously faced great hardship in so many ways. So he's always faced it with such grit and grace. I have no doubt that he will face this with the same strength and courage. He certainly has an incredibly supportive family. Obviously, the hearts, the prayers, and thoughts of all Arizonans and Americans are behind him. And he has an excellent medical team. So he's in great hands, and we obviously wish him all the best. I have no doubt that he's going to face this like he's faced everything else with tremendous courage and strength. So,
what lies ahead for treating glioblastoma? How do you fight it?
yeah, so, you know, the initial treatment was the resection that he had, the surgical removal of the tumor, which, according to radiological studies that he had done after the surgery, sounds like it was very successful.
Okay,
they
good.
removed all of the tumor. It sounds like they felt very confident in the results of that. And now the next step will basically be a plan of most likely chemotherapy and radiation. That will be discussed, obviously, with his care team, but that is standard.
Well, the fact is, it is a huge battle, though, correct? I mean, I've been reading that for folks over 55, only 5% make it 5 years. Is that correct?
Yeah, right, exactly. And median survival is about 14 to 16 months. So there's no question that it is an aggressive tumor. You know, the incidence is not incredibly common. It's about 3 in 100,000, but it accounts for about 15% of all primary brain tumors. And it's an aggressive course. There's no doubt about it. As we know, this is a similar type of tumor that Senator Ted Kennedy had, Vice President Joe Biden's son, Beau Biden, struggled with, and it's aggressive, there's no doubt.
How long do you think this has been there? Is this something, we talk about how it's an aggressive form, but is it something that's been lingering? Is it something that could have developed very recently?
Yeah, you know, I'm not sure about the exact dimensions of his tumor, but what I can tell you is that it's rapidly growing. So it may have very well been there just for a few months. I would have a hard time estimating that based, you know, you'd have to know the size of the tumor. But from what I understand, he really had minimal if no symptoms. I know he went in for a routine physical exam. He had some complaints of maybe some intermittent double vision, maybe feeling a little foggy or dizzy. And that's not atypical. Sometimes folks don't know it, they have it until it's much further along. And it depends on the location. If it's in certain places in the brain and depending on the size, you can have more serious symptoms. You can have headaches, nausea, vomiting, dizziness. It can impact memory, speech. But in his case, it sounds like his symptoms were minimal, if at all.
One more question. If you were his doctor after his initial treatments, what would you suggest to him? Can he go back to work, or would you suggest not to?
Well, I think we're getting ahead of ourselves with that question, only because I think right now he's recovering from his surgery. That was obviously a significant procedure. So that would be the focus right now for him to recover from that surgery. And then he'll have discussions with his medical team about the side effects and issues that come along with radiation and chemotherapy. And, you know, I think the primary focus will just be focused on his well-being, his strength, and how he's feeling, and they'll have to judge that day by day, you know, with input from his medical team and his family. So I think that's difficult to assess, and that will be, you know, clearly up to him and his medical team. But like I said, I think all the best odds are in his favor. He's such a man of grit and grace, and he has certainly all the support and good wishes of so many folks around the country. So we just like to send our best wishes to him and his family, wish him a recovery, and just that, you know, he knows that he has such love and support all around the state.
And that can go a long way.
Well, thank you for your time this morning. We really appreciate it.
Absolutely. And I'd just like to say that you know, we were talking about possible therapies, that's just another reason why the continued fight with medical research and in this cases of brain cancer and cancer of all nature is so important that we continue that, because that'll make a huge impact on patients just like Senator McCain in the future.
It sure is.
Absolutely.
Well, thank you for your insight.
Thank you so
Absolutely.
much.
Thank you for having me.